So far this week, we have worked on developing your clinical skills in terms of describing the signalment of a dog, observing an animal carefully to identify as much information as possible, and measuring the respiratory rate of an animal and comparing this to reference ranges for vital signs. All of these skills should be performed at a safe distance from the animal without restraining it. We are now going to move on to the final section of the Clinical Skills Week, and this will give you a brief overview of some of the general examination skills that a veterinary surgeon may use. However, it is very important that we emphasise that the skills demonstrated in this section are being carried out by trained veterinary professionals and are for your information only. For the safety of both yourself and your animals, please do not undertake these procedures at home unless you have had professional veterinary or veterinary nurse training. Please take a moment to read through the important content of this disclaimer slide. In a moment, my colleagues will demonstrate a basic physical examination of a dog, and we will talk you through some of the skills that they are using. They will start by observing the dog from a distance in the waiting room, so remember back to some of the important points that we discussed earlier this week regarding observation skills. You will then notice that Caroline, a qualified veterinary nurse, will be restraining Juno the dog, whilst Neil, a qualified veterinary surgeon, performs a basic physical examination. As you saw in the previous section of this MOOC, a physical examination is usually performed after taking a history from the owner. Our aim over the next few minutes is to give you a basic overview of what a veterinary surgeon is looking at when they examine a dog. We should, however, point out that we are only undertaking a very basic general health check type examination here, and we are intentionally not recording the rectal temperature of the dog. Many veterinary surgeons will carry out a more detailed examination if an animal is suffering from a specific complaint, and we do not intend to include a comprehensive examination in the following clips. So take a moment to look through the clips that are coming up, and here we can see two dogs in the waiting room, so Juno the adult Labrador and Seal the puppy. And we can just see from our observation skills that both dogs are bright, alert and responsive. They're interested in their surroundings. They're relatively well behaved and sitting calmly. From this clip we can see that Seal is a female puppy and that Juno has nice, clean, healthy teeth with minimal tartar on them. And Juno the adult is also relaxed enough to lie down in the waiting room in a strange environment and still look relatively relaxed. Seal's enjoying some attention there and getting in a cheeky nibble. So now Neil, my colleague, is going to examine Juno, and he starts by evaluating her head, looking at the symmetry of both sides, then looks at her eyes to evaluate the colour of the membranes, which should be a nice healthy pink colour. He's looking at her teeth and her gums now, and he's just checking that the capillary refill time, which is an indicator of her circulatory function, is within normal limits. He's checking her ears for any discharges, redness, inflammation, or any problems that can be identified. He's then feeling under her chin for structures called lymph nodes, which can be enlarged if there's any inflammation or infection. And there's also a lymph node in front of her shoulder blade that he's just checked there. He's using his hands to palpate her body and just identify any abnormal lumps or bumps. He's now using his stethoscope to auscultate Juno's heart, so he'll be listening to the heart sounds and the heart rhythm. He's also feeling her pulse at the same time in her hind leg. And he'll record the heart rate and compare this to normal limits. It's important to listen to the heart on both the left and the right hand side. And similarly to listen to the lungs on both the left and the right hand side, which is what he's doing here. He then moves on to just feel down her legs for any obvious abnormalities, and there's a final lymph node in the hind leg which he's feeling for there. He's then checking under her belly, so at her umbilicus or belly button, and also checking each teat for any mammary swellings or abnormalities. He's now moving around to palpate her forelimbs, so he's comparing left and right sides and just picking up any obvious abnormalities. It's also possible to extend and flex each joint individually. And now he's doing a similar palpation of the hind limbs. And then moving on to examine the foot in more detail, so checking between each toe, looking for any redness or infection or inflammation, and checking the pads at the same time. Also the claws and the length of the nails. And again, here you can see that Juno's got really nice bright eyes. She's got no obvious ocular or nasal discharge, and that she's generally a bright, alert and responsive dog. So that concludes our clinical skills week for you. We hope that you've felt we've introduced the concept of clinical skills. We've worked with you to be able to describe the signalement of an animal, work with your observation skills to pick up as many abnormalities as possible, to be able to identify the respiratory rate of a horse, a cow and a dog and compare this to normal reference ranges. And then we've just given you a very brief overview of general examination skills that veterinary surgeons will use when they examine a dog. So we hope that you've enjoyed the week, and thank you for your attention.